Specialty Hospitals in Madurai.
To Satish Srinivasan. Good afternoon, everyone. I thank ASI Critical Institute for this opportunity. So when I started this presentation, role of radiation in breast cancer, I think the surgical students here will know in one slide, or slide 4 actually. So I just wanted to pad up to add some insights about philosophy about how breast cancer is managed. So I thought whether my slide should address the PG who is facing the examiner or it should address the PG who is facing a patient. So I decided I will address the topic from a point of view of a PG who is facing a patient, right? So you have diagnosed a breast cancer, the patient is coming to you. What is the purpose of, what is the aim of treating a breast cancer? You can say in technical terms if possible. When you start treating a patient, what is your aim? What are you trying to achieve? What are you trying to achieve? Cure. Okay. Can you define cure? Can any of the PGs, final year PGs define cure? We can be first year PGs also. One person loud? Okay, don't read it up. So, the aim of treating a breast cancer patient is to achieve survival. So, again, there are different categories of survival. So, one is you diagnose a patient, you treat the patient, you make the patient without cancer. So, the patient is cancer free and is living. This is called disease free survival, right? So, after 3-4 years, the patient develops a recurrence. It can be a local recurrence, it can be regional recurrence or a distant metastasis. Now the patient has the disease but is living, you start some treatment, right? And the patient is living without symptoms or with the symptoms. So that becomes an important point. A recurrent patient, they have cancer, but our aim of treatment is two things. One is to make the patient live longer, another is to patient live without symptoms. So whenever you are making the patient live without symptoms but with cancer, that is called progression-free survival. Living without cancer is disease-free survival. So at some point of time, even after treatment, all treatments have failed. So the patient continues to have disease, continues to have symptoms also, but the patient is not dead yet. They will live on for a few more months. So what is this survival called? This is called overall survival. So if a patient is diagnosed with CA breast in 2010, they die in 2025, let us say, they will go through all these phases. They will go through a phase of disease-free survival, then a progression-free survival, then living with symptoms. So when you see a patient, what is your aim? Your aim is to increase the disease-free survival as much as possible. If they tend to develop disease, your aim is to increase the progression-free survival as much as possible. And if nothing else fails, you give overall survival. So this is the aim of treating a breast cancer patient. So what are the factors? Now we know what we want. We want survival. So what are the factors that go into deciding this survival? So number one is stage. Then we have the therapeutic options, surgery, radiation, and I have put systemic therapy as one phrase that includes chemotherapy, that includes hormone, checkpoint inhibitors, everything. So I have put it as under the basket of systemic therapy and also the biology. It is not like a CA vocal cord is, you see 100 patients of CA vocal cord, all are CA vocal cord patients. But you see 10 patients of CA breast, one is ERPR positive, one is HER2 positive, you have many subsets. So every different subset will have different outcome. So the biology of the tumor is also a factor in influencing survival. It used to be separate, the systemic therapy and biology used to be separate independent factors till some time back. But because most of the biological factors are being acted upon by drugs, I have made it into a single basket. So we will take out this biology and we will keep only systemic therapy as the factor that is influencing survival. Now we have 4 factors, that is stage, surgery, radiation and systemic therapy influencing survival. So far is it clear? So far can you follow it? Right. Now, don't be put off by all the fancy discussions. Remember, for stage 1 cancer, breast cancer, the survival is 95 to 100%. So it is very important to remember this. When you see a stage 1 patient, you will automatically think like, I don't know what to do for if it is this subset, if it is that subset, all these sorts of confusions will come. But it is at the baseline you have to remember they are likely to survive 95 to 100% more than 5 years. That fact is not to be missed. So, of these 4 factors, surgery, stage, systemic therapy and radiation, what is the relative contribution of each to this 95 to 100%? Can anyone take a guess? Patient has a probability of surviving 95%. How much contribution is given by the stage? How much is given by the surgery? How much is given by radiation? How much is by chemo? Then only you will understand the relative importance of each in achieving that cure. Does that make sense? Right? So can you take a guess? Relative contribution of each to survival? This, thanks to ChatGPT, I thought of 2 analogies to make this idea. I made an image for this, the other one I had to make. So that person driving is the medical, not by any additional treatments that you are going to give them. The major contribution is by the stage itself. And who decides the stage? I always tell the patients when they walk in, who decides the stage of the patient? Who? Patient himself decides. Stage is decided upon the date on which they walk into the hospital. So sooner the patient comes, lesser the stage. So the biggest contribution to cure in stage 1 is provided by the patient itself. And other treatments, I have mentioned systemic therapy and radiation therapy. I have not mentioned surgery at all here, and I am talking in a surgical forum. Can you take a guess why? What is the role of surgery here? Surgery is the very vehicle. Without that, there is no such thing. You cannot use the horses at all. Till date, there is no trial which has proved that without surgery, it is possible to cure a surgery patient. Like it will change in future. Whatever you will listen in October will change in April next year. But as on date, without surgery, there is no discussion of curing a patient. If you think about it this way, when you do a staging workup, we have 2 staging. One is clinical staging, another is pathological staging. So what surgery does is, it freezes the stage of the patient. So if you don't do a surgery, the stage will keep on evolving. So what surgery does is, it contributes by freezing the stage in that particular setup. That is why we have only a pathological stage. When the patient develops a recurrence after radiation, a recurrence after chemotherapy, you don't do a new staging. So it is simply labeled as a recurrent disease, a metastatic disease. So surgery role is, right now, there is no quantification of that, but there has been no trial which attempted to see that. Now, so if you, another analogy that I thought of is, I think everybody is comfortable with Tamil here. So, for a 10th particular student, somebody who is already excellent, by giving additional tuition, you are not going to add any benefit to it. But somebody who is not very bright, you have to give additional tuition. So, your radiation systemic therapy, you are not tuition teacher, nothing expert. So, somebody who is already bright, you don't need that. So, that is the idea. So, relative contribution of, in stage 1, systemic therapy and radiation, relative contribution is less. The stage itself provides maximum contribution. Again, surgery, we never know, it is probably infinite. There is no data for that. So let us, this figure I want you to remember. In terms of absolute number contribution to overall survival, in stage 1, the contribution of systemic therapy is 2 to 5%, whereas the role of radiation is 1 to 3% in patients who are undergoing BCS. In mastectomy patients, we are not going to give any radiation, it is not going to have any impact. In patients who are undergoing BCS, when we are going to add radiation, this is the contribution to the survival advantage. So 2 to 5% for systemic therapy, 1 to 2% for radiation therapy. Stage 2, the survival is 85 to 95%. If you see, as the stage goes, the contribution of the stage comes down, obviously, and the contribution of the therapies go up. So in systemic therapy, the contribution is 3 to 9%, and radiation is around 2 to 8%. Can you guess what will happen in stage 3? In stage 3, what will happen? The contribution of the stage will come down further, and the contribution of the treatments will go up. So this absolute numbers is important to remember, not to forget. Because I'll tell you, I will rephrase this particular slide. The patient is coming, stage 3 breast cancer is coming. Patient is saying you are advising chemo, I am advising radiation. The patient says, எனக்கு இந்த ட்ரீட்மெண்ட் வேணாம் டாக்டர் அப்படின்னா என்ன நடக்கும் உங்களுக்கு, எனக்கு என்ன ஆகும் அப்படின்னு அந்த பேஷண்ட் கேட்கும்போது how will you explain it to them? You will tell you are likely to get cancer, right? You are likely to get a recurrence. How likely I am to get a recurrence? This is a very valid concern for many patients who deny treatment for X number of reasons, right? So this is the answer. If you don't take treatment, if you take, let us say, if you don't take systemic therapy, you have a 12% chance of getting a recurrence, getting a metastasis. Similarly, if you don't take radiation, you have a 5 to 10% chance of getting a recurrence. So this number is going to help you talk to the patients when they have such queries. So this is again an important slide. Sarah has mentioned about it. In stage 4 breast cancer, the 5-year survival is around 30 to 40%. Stage 4, right? So the contribution, what is the maximum contribution provided here? It is by the systemic therapy, because surgery and local therapy do not provide overall survival advantage, but only the systemic therapy does. So this is about the relative contribution of different treatments to the survival of the patient. So why this is there? Because of a topic. What is the role of radiation in breast cancer? So it provides overall survival advantage. So RT contributes to disease-free survival, progression-free survival, and overall survival in stages 1 to 3. And it provides progression-free survival in stage 4. So this is the role of radiation in breast cancer. I will go to specific scenarios. So in stage 1, only if there is BCS there is role for RT. If there is MRM has been done, there is